Horton, Director of Yavapai County Community Health Services. I'm joined today by Stephen Everett, our Yavapai County epidemiologist and expert of all things COVID-19. Today we'd like to give you a snapshot of what we're seeing in Yavapai County. As over the last several months, we were seeing a decrease in overall COVID-19 pretty much since the holidays, and we had low levels of new cases per day, while we were able to vaccinate many of our Yavapai County residents. We currently have about 43% of our total population that is vaccinated against COVID-19. However, recently, we have started to see an increase in new COVID-19 cases here in the county, as well as across the state, and really across the nation as well. We are concerned about this new increase in cases, and we want to make sure that we can give you an accurate snapshot of what we're seeing now, as well as give you enough information to make good decisions about your own health and how you interact at this point in time based on what we know. As of today, July 28, 2021, 20,749 individuals in Yavapai County have tested positive for COVID-19. This week, we're averaging about 59 new cases per day, and we have recently entered back into a level of substantial spread of COVID-19 across the county. So far, we've had 541 deaths due to COVID, and we currently have 47 hospitalizations between YRMC, BVMC, and the VA. From what we're seeing, about 85% of our current hospitalizations are unvaccinated individuals. About 15% of those are vaccinated. We don't know if they're fully vaccinated or partially vaccinated. And from what we're seeing countywide, which you'll hear more from Stephen in a moment, we're seeing that about the same proportion of folks are coming down with COVID-19 symptoms and testing positive. About 85% are unvaccinated, about 15% are vaccinated. So we do know that the vaccinations being provided here in our county, we have Pfizer, Moderna, and Johnson & Johnson. These vaccines are being very effective in reducing people's overall severity of symptoms, as well as their chance of becoming severely ill or hospitalized with COVID-19. Most of the cases that we're seeing are in the ages of 25 to 65. Those are our working-aged individuals across the county. And most of our cases are coming from Prescott Valley and the Quad City area, followed by the Verde Valley, which are our most populated areas of the county. And now I'm going to pass this over to Stephen Everett, who's going to give us an update on what he's seeing in terms of COVID-19 in Yavapai County, as well as some of the recent guidance that has come through from the CDC in the past day or two.
Hey, thanks, Leslie. So far, we've seen increases in cases. Don't know how long the spike will last for with the vaccinations. It could be small, like last winter, or large, like last summer. So we're not sure yet at this time. But we are seeing increased cases all over the board. They're mainly being driven by working age adults. We're still seeing low numbers among children and teenagers, and low numbers in people over 65. And CDC has recently come out with some new guidelines, updates as of July 27th. The key points are for fully vaccinated people that you can still participate in activities anytime you did before the pandemic, but you may want to wear a mask. You can resume domestic travel and refrain from testing before or after travel. For unvaccinated people, we do recommend people get tested before traveling and 3 to 5 days after traveling. For international testing, you don't have to unless the country you're traveling to requires it. Fully vaccinated people can refrain from regular screening. Infections do happen in vaccinated persons as it does in people who've had COVID before. So if you've had COVID or had the vaccine, it doesn't mean you're 100% protected from getting reinfected. So in situations such as this, in indoor settings, you may want to wear a mask. If you're around people who are unvaccinated or immunocompromised, you may want to wear a mask to protect them. You want to get tested if you experience COVID-like symptoms. most cases, these are going to be much milder than in people who are unvaccinated. So if you're having just cold-like symptoms, you may want to consider testing. You want to get tested 3 to 5 days following an exposure to a confirmed or suspected case. And if you are exposed to someone who has active COVID, you should wear a mask for 14 days afterward when you're in public settings indoors. If you do test positive, you want to isolate for 10 days, even if you have no symptoms. And of course, you want to follow all applicable federal, state, and county and tribal guidelines. And recent studies have shown that people who have had COVID have the same amount of antibodies as people who have been vaccinated. So they're roughly at equal levels. But we do encourage people who have had COVID to get the vaccine at least 90 days after having the illness, because it simply boosts your immune system up even more, so you'll have even more protection.
All right. Well, thank you so much, Stephen. I think one of the things that we've learned here locally is that the vaccine does work, as I mentioned, and it is keeping people from having severe symptoms as well as keeping people from being hospitalized for COVID-19. And so if you haven't been vaccinated, please consider doing so. And anyone in our county over the age of 12 can do so. We have providers here locally that provide the Pfizer vaccine that is eligible for 12 and older. And then we also have the Moderna and Johnson & Johnson vaccines available at many providers across the county for those 18 and older. So please go to our website and find out more information about where you can get vaccinated. Most pharmacies, many healthcare providers, and others are providing this, as well as all 3 YCCHS locations, having those vaccinations readily available when you need them. So I have some questions for Stephen, and these are some of the most frequently asked questions that we hear at the health department. So I thought you, our Yavapai County public, may have the same questions, and I'm going to go through these. Some of these we may have answered already, but we will go through a few questions. And next week, actually on Monday, August 2nd at 11:30 a.m., we are going to do a Facebook live stream where you can ask questions to Stephen, to Sally, our immunization supervisor, as well as myself on questions as they relate to COVID-19, testing, vaccinations, and anything else. So please join us next Monday. We'd be happy to inform you on what we know beyond what we're telling you in this video today. One of the very common questions recently is, if you're fully vaccinated and you come into contact with someone who has active COVID-19 infection, so you're exposed to it, do you then have to quarantine?
You don't have to quarantine unless you show symptoms. We do recommend people who have been vaccinated and are showing no symptoms, they should get tested between 5 to 7 days afterward to see if they were infected but are just showing no symptoms. If you're not showing symptoms, you don't need to quarantine. We do recommend that if you do go out in public, wear a mask for 14 days. That would be the only thing that you would do different if you're vaccinated and have been exposed.
And we've mentioned this already, but if you've already had COVID-19 and tested positive at one point in time, should you still get vaccinated?
Yes, they are recommending if you have had COVID, go and get vaccinated. There's no risk in doing so. It'll simply boost your immune system even more. But you should wait at least 90 days between when you got over the COVID and you start the vaccinations.
And what we're seeing with that too is that people's antibody resistance does tend to lessen over time. And so that is where those vaccines, even after you've had COVID-19, can be beneficial to boost your immunity. And this is a question that we've kind of gone over, but because there's new guidance and changes all the time with COVID-19, one of those questions is, do I have to wear a mask if I've been vaccinated?
Generally, you don't. We are recommending you do if you're in indoor settings with a lot of other people. Not only additional protection for you, it's also additional protection for people who have been unvaccinated. So you don't have to wear a mask in indoor settings. We do recommend it, especially if you've been exposed to someone who has COVID. It's simply additional protection.
We do know from recent studies that most of the transmission is occurring indoors. About 10% occurs outdoors. Yet, if you're in very close quarters outdoors too, you should consider wearing a mask, especially at this point in time when we've entered into a time of substantial spread and transmission. And my last question for Stephen is, if I've been fully vaccinated, can I still catch COVID?
Absolutely. You can catch COVID again if you've had the disease or if you've been fully vaccinated. That's not unusual, but you have a less chance of catching it, and you're going to have much milder symptoms and a much lower risk of severe symptoms and death.
All right, thank you so much, Stephen. I appreciate all of the information.
My pleasure.
Stephen has been working incredibly hard over the last almost 2 years now to prepare information, the data that we collect from both testing as well as vaccination. All of the important information that we share here with you has somehow come through Stephen in one way or another, and so we do appreciate the hard work that you've done over time and continue to do. And so thank you very much, and thank you, Yavapai County. I realize that this has been a marathon and we're still here dealing with COVID-19 long after we thought it might be gone, but we do need your help in order to cut down the spread. If you haven't been vaccinated yet, please consider doing so. There are plenty of opportunities across the county to get vaccinated, especially if you're those that would be considered high risk for complications, hospitalization, or even death due to COVID-19. Please also follow all those recommendations that the CDC as well as the County Health Department have given you, and consider wearing a mask when you're indoors, washing your hands more often, physically distancing where you can, and most importantly, please stay home when you're sick. We will continue to provide information to you as we have it and continue to update you on the latest recommendations. For now, please consider watching our Facebook Live event next Monday at 11:30 a.m. and keep up the good work. You're doing a great job.